Good morning, good afternoon, good night. I'm Dr. Julio Reinafarge. I'm here with you to do a DHP talk. We're going to talk about our doctorate of healthcare business that we are conducting with the Global Summits Institute. And today I'm here with Dr. Arash Hakhamian. He is one of our faculties at our DHB. I'm very pleased, I'm very honored to have him with us today. And we're going to talk a little bit about one of our courses that he's going to conduct in our DHB. And he will talk about a very, very interesting and it's a very essential course in our DHB. He's going to talk about Tele-Dentistry and how it works for all of our healthcare community. So, Dr. Arash, thank you very much for being with us today.
Thank you so much for having me, Dr. Reina. It's a pleasure to be here. Thank you to the Global Summit and DHB for inviting me to be a professor on this subject, which I believe is really going to play a crucial role in the expansion of care and really helping dentists and patients and the medical professionals all communicate with one another. And really, it's going to be an exciting and revolutionary new way and evolution of our industry. So I'm very excited to be here and have the opportunity to share this with everyone.
Thank you. And let me know a little bit. What do you think about telemedicine right now? Because we have changing times. So what we are having is after this pandemic and all that we live all around the world, everything changed and dentistry and medicine and chiropractic and everything has changed. What do you think about that? How it's these changing times is working with telemedicine and how telemedicine evolve in the future and how it's going to grow in the future?
You know, it's very interesting. To many people, this seems like a new concept, something that's happened recently as a result of the pandemic. And really, if you look at everything that happens in the world, really everything happens in cycles. With the economy, with real estate, with with policies, everything happens in cycles. People are very interested when they and surprised to hear that we have been practicing telemedicine for well over 100 years already. In the early 1900s, we were sending patient information through EKG, through the telephone. We were sending through Morse code. And this is something that is a concept that is not really new. I think the pandemic has now really put it back in front of everyone's eyes, and really because we had such massive shutdowns, because the access to care was so limited, we had to revert back and really reevaluate how we're using telemedicine. And because of the new advances in technology, I think what's really changed is the technology side. We used to do house calls, and we had doctors going directly to patients' homes, providing care on site. And for a while, we stepped out of that and went back into the traditional brick and mortar setting. And now you can see again this cycle, whereas everyone is bringing services directly to the patients. This includes chiropractic care. This includes, optometry. This includes clear aligners, like companies like Smile Direct Club. So it's all a cycle. And what's really changing now is just the technology and the range of capabilities that we have. So absolutely, I think the pandemic has really reintroduced this concept. And this is one that has now been adopted by insurance companies. It's been adopted by government agencies. And we can now see a reintroduction into the traditional brick and mortar office, into hospitals, and into medical offices. And this is something that's not going away. The benefits have been proven through scientific research. We have Professor Paul Glassman, with whom I work at the American Dental Association in advancing the policies that pertain to this. They have, long-term studies that have shown that this is something that's going to be beneficial to patients, and it's something that can bring down the cost for the patients and also introduce new revenue streams for clinicians. So we are in the very early stages, and we anticipate that this will be a household name and really something that is implemented in the majority of offices over the next 5 to 10 years.
Wonderful. And what do you think also when I heard about telemedicine a while ago, I found that many people identify what is telemedicine with just it's like a Zoom call, and that is not telemedicine, because telemedicine is evolving and it's going to do an evolution trip. So in this evolution trip, we're going to see that they are going to work like things like AI and also wearables and many things that permit all the doctors to do a follow-up of their patients at home, as instead of having them at the hospital, and they can monitor all the patients in this way. What do you think about that? How it's going to change the world of telemedicine in the near future and in the middle future?
So telemedicine or telehealth is the really broad description, and within telemedicine falls so many different verticals. I think one of the biggest challenges we've had on our side is that we are exposed to the patient for such a brief period of time. We get to see them in our office. They tell us whatever they can remember. Sometimes they don't tell us everything. So we do everything the way that we were trained. Hopefully we follow all our protocols, we're consistent, but still we see some of those cases that for some reason are failing. And we don't know why. Why did that perfect implant fail? Why is this patient still having periodontal disease after multiple rounds of, cleanings and antibiotics? And really what telemedicine is going to allow us to do is be able to maintain some level of communication and control and observation with our patients, even when they leave the office. I mean, imagine being able to evaluate the patient's diet, evaluate the patient's life, the life habits, and also be able to see if that patient is actually brushing, if that patient is actually, how long they're brushing. So we're now able to have a little bit better understanding of really all the other variables that we were missing in the past. We have toothbrushes now that can detect where you are brushing and allow the patient to actually monitor the problem area. So a dentist can theoretically say, I really want you to focus in this particular area. And through the software, we have Sonicare, we have Oral-B, multiple companies who've actually integrated that artificial intelligence into their toothbrushes and into the software. So we can actually see if that patient is brushing, and we can see how often they're doing it, if they're brushing correctly. So we can also integrate with existing apps on people's phones. And everyone has a phone, right, Julio? I mean, we're talking about billions and billions of people. Some of the poorest, most underdeveloped countries still have everyone with a cell phone in their hand.
Yes.
And so this is a huge opportunity to have that virtual connection with our patients now. So we can see with their existing applications, with the health apps, with the diet apps, their sleep patterns. And obviously there's a level, that also makes me uncomfortable about invasion of privacy. And this has really, when you get down to someone's well-being, they can decide to what level of access they want to provide you as far as, these things that I'm mentioning. But when it comes to someone's health, I think that it's our responsibility to really be able to use the full resources that we have available to us to really help that patient. I mean, there's nothing more heartbreaking than having someone's implants fail repeatedly, going through multiple surgeries, or realizing that this patient had bacteria in the mouth that could potentially lead to Alzheimer's disease. And so it's our responsibility as doctors, as dentists, to provide these opportunities for the patients to better take care of their health. And I think integrating some of these remote monitoring capabilities, some of the mobile health, the virtual video consults, and also just being able to maintain that patient's health records and being able to share it with other doctors. These are all components of telemedicine. So telemedicine is very broad, and people think, hey, I can't do root canals over the phone. I can't do it through a video call. But imagine all the other things that we can do, and imagine if some of these real pain points that we have can be addressed so that we minimize the amount of root canals. And we can make sure that if the patient is coming in, we actually have taken care of all the other issues so that you can do production. You can actually produce, use your time wisely instead of going over their health history, instead of getting consent forms signed, on the day of. If all this stuff can be done through telemedicine prior to the appointments, we can really increase the efficiency of medicine and dentistry. And we can also follow it up with patient remote monitoring, whether it's through wearables. We all have now, you can put a sticker on your arm and just press a button and you can see what your glucose levels are. And so you can better monitor and maintain your health. There's wearables that will give you in real time your respiration, your pulse. I have something on my watch that I can just press and I can see my heart patterns and potentially predict heart issues and heart attacks. So it's far more than just video conferencing. I think that is the fallacy, and this is really why this course is important, because we will not only be able to teach our students some of the emerging technologies, but also be able to introduce them to new ways to better serve their patients immediately with existing technologies that are available today and have been available for quite some time.
So how are you going to focus in your course this technology? How do you think about how all the students are going to focus in tele-dentistry and what they will learn with all this course?
What's really important for us is first is knowledge. Knowledge is power. And the people who know about these technologies and these opportunities are some of these big corporations that have the time to be able to evaluate how these particular technologies are going to develop over the next 5 to 10 years. And they can already see exactly where the opportunities are, what the laws look like, where, what areas things are permitted in, what areas things are not permitted in. And I think that it is crucial for us from the doctor's point of view to be aware of these things as well. If not, we will not have a say in shaping the future of the direction that our field go into, right? So the doctors have to be involved in shaping the future of our own profession. So I think one of the most important things is first, get a really good understanding of what it is that we're talking about. Are we talking about video conferencing? Are we talking about procedures? What is the range of capabilities that are available today? And what are the capabilities that we're working on for tomorrow? What are the legal implications? What am I allowed to do? What am I not allowed to do? Where am I allowed to do these things? And also, as doctors, we also have a component that is very business oriented. How do we take advantage of these business opportunities and make sure that we have successful offices? If a dentist is retiring, do they necessarily have to stop and basically just stop all of their clinical practice? Or is there a way to transition from clinical work into taking those years of knowledge and experience and applying it now through telemedicine and continue to help patients, continue that relationship that we have with our patients, and still generate income and not have to necessarily do day-to-day work in the traditional brick and mortar setting. So the legislation is definitely something that we're going to talk about. The protocols of how to implement these things properly, emerging opportunities, and then really go into some of the literature and scientific, research that's been implemented over the last, 40, 50 years, and be able to have the same amount of understanding about this technology as we do about composite fillings and implants. So that's really our goal, is on a very high level to be able to introduce these concepts and prepare clinicians for what is absolutely coming, and I can tell you definitively is not going to go away. So instead of waiting until it's too late and until we have corporations who've implemented these policies on our behalf, it's very important for us as clinicians to get that understanding and be actively involved in shaping where this industry is going from within.
So it's gonna be like also like a link between a medic, like an MD, a dentist, and also a chiropractor, and all that stuff, and all those healthcare sciences that we're having. We're gonna be linked together using this kind of telemedicine, or this kind of platforms that are gonna integrate all of us in just one communicate. It's gonna be like a multifocal communication between all the specialties in healthcare. That's what you think?
Absolutely. Absolutely. It's definitively going in that direction. We all preach to our patients that everything is connected. We tell our patients, if you have diabetes, this can affect your gums. If you have gum disease, this can affect your, potential Alzheimer's. So everything is connected within our body. But there is this massive disconnect between the medical profession and the dental profession and other professions that really have a massive influence on the patient's overall health. So no longer do we have to be bound by geographic limitations and not have to worry about how do we share information. Oftentimes someone needs a surgery, they need to get a hip replacement or a joint replacement, but that entire process is delayed because they have to wait for dental clearance. Or a patient really wants to restore their teeth, and in order to get that surgery, they have to go through the medical clearance. So we have these delays. We got to print something out, we got to fill it out, we got to fax it to the doctor's secretary, wait till they respond. And these delays are exacerbating the patient's conditions. So in order to really be able to give comprehensive care, we need to have that same communication that body parts have with one another, except now we need to have it between our professions. So absolutely, now technology will allow us to share patient information in real time, have patients have accessibility to their personal health information in real time, and then be able to facilitate referrals. We need to be able to get, we talk about clinical collaboration. Sometimes we're talking about the general dentist and the specialist, but sometimes within that conversation needs to be the medical doctor and the physicians that are also involved in the patient's well-being. So it is undoubtedly going in that direction, and telemedicine and the technology that we have now is going to facilitate that.
Okay, wonderful. And everyone right now is talking about AI. Artificial intelligence is also part of our lives. We are going to see artificial intelligence in many platforms and in many places that we're going, and we are not aware of. They are using AI, and they are using it right now everywhere. So how do you think about AI and telemedicine and this D2D relationship that we're going to make through these kind of platforms?
So, artificial intelligence is being currently used pretty much in most aspects of our lives. Artificial intelligence is being used within your Gmail account, within Facebook, within Instagram. It's being used to conduct traffic. So this technology is not new. It's been around for a very, very long time, but there are new and innovative, applications within medicine. So I'll give you one example. We have intraoral cameras, a small portable camera that can actually be given to the patient, and the patient can take this home And every single night they can screen their own mouth. They can look for cavities. They can look for cancerous lesions. They can look for infections. And this is something that, is a self-monitoring tool that an artificial intelligence application can help with. So a dentist doesn't have time to sit there behind a computer and watch, every day, watch the person brush their teeth or do a scan of their own mouth. But this is something where artificial intelligence can complement the traditional care that a dental provider is used to, and be able to identify early lesions and potential problems before they get out of hand. And this is something that will notify the doctor, it'll notify the patients, and then that patient can then be screened and go in for the traditional checkup. So artificial intelligence is not necessarily going to replace the dentist, but it is going to replace a lot of the archaic, the archaic and really outdated procedures that we have. For example, we can upload a patient's x-rays now, and we can utilize artificial intelligence to decrease the amount of procedural errors. So we can actually see the different cavities, open margins, things that maybe the person's eye will miss, the actual artificial intelligence will identify. Now, this is a neutral software. They don't have any incentive to sell anything to the patient, to try to force unnecessary treatment. This is something as a neutral, tool can now help and identify things that maybe we missed. Maybe we didn't see that early cancerous lesion. Maybe we didn't see that periapical radiolucency. So in one way, it's going to really help with diagnostics. It's going to really help provide a significant amount of information that may be missed by the operator. And it's also going to create a lot of consistency, right? So you won't have this dramatic inconsistency getting a treatment plan in one office and getting it in another. Now you're going to have the same set of information, and people, there was this article a couple of years ago, and they had the same patient go to 10 different dentists, and they got 10 different treatment plans.
Yeah.
And this is part of the issue, is this creates significant doubt in the patient's mind, is what is going on? Why am I getting 10 different treatment plans? Why is it so hard to stay consistent? Well, part of the problem is the information with which we're dealing. And then artificial intelligence beyond that never gets tired. It never goes to sleep. So now we can have, instead of shutting down our office at 5 or 6 p.m., and the patients have no access to any kind of answers, if there's an emergency, which usually occurs, 70% of emergencies occur in the evenings. The patient lies down, the positional change causes a fluid movement in the tooth, and now you have pain. And where do you go? You end up in the emergency room. Over 2.2 million people end up in the emergency room every single year for preventable dental emergencies. And so can we address these things utilizing artificial intelligence, where the patient can call in after hours and almost ask their questions and have artificial intelligence respond with the right answers? We don't have to rely on one of our front office staff who's tired, who may be cranky that day, who may not know the answer. We can now rely on consistent and credible information to be able to engage those patients. So in a sense, we're really increasing that comprehensive care, increasing the amount of hours we're available, increasing our consistency. And then utilizing artificial intelligence, we can also increase the monitoring of the patient after they leave our office. So are you brushing? By incorporating artificial intelligence, we can tell if someone is brushing the right areas. We can tell if the person is brushing long enough. With clear aligner cases, we can tell the movement of the teeth by taking photos, periodic photos, with a cell phone camera, or with a intraoral camera like the mouth cam. That is something that the patient takes home with them. And artificial intelligence can tell us where we were, where we're going, what the current conditions are, and it can also help in giving us options of, you know, where to go from here. So we can really use this as a tool that is in the professional's arsenal, and really when you combine that with machine learning, where it's not only artificial intelligence, but it's also learning. It's also seeing everyone else's experience. It's getting data from so many different resources. This is now all of our experiences and knowledge being combined together to create a broader understanding of what's going. So we're no longer limited by one person's experience, but this is going to be an amalgamation of research, clinical experience from a really broad audience. So there's going to be a massive curve here, and this is something that I think the consumers demand. And once they get a taste of this new world, I don't think they'll ever be able to go back.
Yeah, sure. And I am sure, and it's going to be affordable in the future also. It's not going to be, you don't have to pay a lot to get all these technology inside of your house. It's going to be more, it's going to be get in every house around the world. And we're going to have, we're going to be able to treat people from maybe too far from us, and it's going to be, it's a second opinions for every patient around the world. Also, it's going to connect a little bit more all this world of healthcare and dentistry and medical world together. I have a better relationship to our patients, and everything goes into our patient's health. Also, it's going to improve the patient's health. It's going to improve the patient's wellness always. So I think that is going to work really fine. And just you're gonna present us something today. You have a presentation ready?
Yeah, I'll show you some stuff. One of the other things I wanted to mention to you is not only is it going to improve the patient's health, it's also going to improve our ability to run a practice.
Yeah,
So,
sure.
you know, artificial intelligence doesn't necessarily need to be bound to the clinical aspect. Imagine the artificial intelligence software knowing your inventory at all times, being able to automatically order whatever supplies and materials that you need, being able to screen your patients to see if they're going to be a good fit for your office, to be able to help with, insurance companies now are using artificial intelligence to evaluate your billing. And the IRS is using artificial intelligence to evaluate whether you filled everything out correctly. So these bigger entities are cutting down on the improper billing practices of certain offices, and decrease that wasteful spending. And once their costs go down, we hope to see that translate in, maybe higher reimbursements for us. So we got to cut out a lot of the unnecessary fat that's currently in our policies. Instead of having to call the insurance company and wait on hold for 30 minutes to get a patient's breakdown, you'll have this information accessible to you in real time. And so you won't have to spend so much money on multiple secretaries who are doing these constant repetitive tasks. So this is, something that's not only going to be very impactful on clinical health, but it's also going to be something that's going to really help out tremendously in office management, communication, scheduling. The other key component is really being able to and stepping away from artificial intelligence and machine learning. I think one of the things that telemedicine is going to allow us to do is leverage the amount of numbers that we have. So the doctor can only be in one place at one time, but we have a lot more readily available hygienists and mid-level practitioners that can go to the patient's home, that can go to the hospitals, that can go to the hospices, senior centers, and provide what they do every day. They can do the cleanings. for these patients who would have never made it to the office anyway. So we have, patients who are disabled and who are just, geriatric patients. It's difficult to get to the dental office. And so how do we address this? Either we have to set up dental offices within every senior center or every retirement home, or we have to have the doctor physically go out, which is really not feasible, right? I don't know too many doctors, who want to drive around. Some do, and we've seen traveling specialists, but we can certainly have our hygienists and our mid-level practitioners go out, take x-rays on site, and this is all done through telemedicine under the general supervision of the dentist. So the dentist can monitor, they can take the x-rays, the assistant or hygienist can take the x-rays, they can do the probing. With an intraoral camera, we can physically see inside, we can see inside the patient's mouth. So all of those things that we need in a dental office can really be achieved on site in the patient's comfort. And we also open up this huge population who has massive anxiety and fear about going to the dental office. When you walk into a dental office, someone who's nervous and anxious, their anxiety triples. And this has been shown by research. They haven't even entered the clinical room. They're still in the waiting room and their anxiety has tripled. So by changing the environment, by changing the sounds and the smells of the traditional dental office, we can provide a lot of these initial services and now really open up that door to a large part, portion of the population that wouldn't come to the dental office unless it's an absolute emergency, until everything has gone wrong. So telemedicine at this point doesn't really have to involve reaching through the camera and doing a root canal over the phone. It may involve sending a kit to the patient's home and getting a saliva sample, having that sent to a lab and being able to assess the patient's oral microflora, and then being able to potentially send an impression kit. And these are companies that are doing this now, right? So we have companies that are sending an impression kit directly to the patient's home. The patient can take an impression, send it back, or the patient's caregiver can take an impression. And there's videos and tutorials on how to do this, very simplified. This can get sent back to the patient's home and then to the laboratory. And then you can make a night guard, you can make whitening trays, you can make clear liners, you can make splints, you can duplicate a denture, you can do evaluation of the patient's periodontal health. So we can actually do practical procedures through telemedicine. And then one step further from that, imagine one of the main issues that we deal with in our office: grinding and clenching. We don't know when the patients are grinding. We just see the problem after. We see the aftermath. We see the abfractions. We see the craze lines. We see the chipped porcelain and failing implants. We see the bone loss. So imagine if within our night guards, we can actually, and this technology again is here today, we can actually see how often the patient is grinding. We can monitor that, right? Within the night guard, there are sensors now that can detect the amount of bruxism, the quality of sleep, how often and how hard you're clenching your teeth. And then we can go ahead and change our treatment plan or basically provide, services within the office to decrease the amount of those episodes. And we can all do this because of telemedicine. So that remote patient monitoring is something that I feel is very interesting. We see it in all other areas of medicine, from, as I mentioned, respiration, checking pulse, blood pressure, all this stuff can be done virtually. But now in the dental field, we can actually evaluate using our, just cell phones. We can see the movement of the teeth. We don't have to wait till that patient comes in next month to do an ortho check. We can evaluate and monitor this over a period of time and see if it's going in the right direction, and have an alert set up as soon as it occurs. We can now see recession occurring. We can now monitor our patient's bruxism. So this is something that I think is going to be really helpful. And then within retailers like Walgreens, like Walmart, some of these major pharmaceutical chains, you can now start to expect to see teledentistry kiosks. So the patient is going directly to the pharmacy, and right then and there, they can check their blood pressure, they can check various other vitals, and right then and there, they can have an intraoral camera and an intraoral scanner available that'll be able to scan the patient's mouth. They'll be able to do a video conference directly with the doctor, and then they'll be able to get that prescription sent electronically right then and there to the pharmacy. Wonderful. So you can see the convenience factor, you can see the decrease in cost, not only to the patients, but now you can have virtual dentists and virtual doctors who don't need to spend, hundreds of thousands of dollars in the traditional brick and mortar setting. New students who are graduating, who may not have, $500,000, $600,000, $700,000, they don't necessarily have to go become associates for 4 or 5 years while their interest on their student loans is accruing. They may be able to set up a virtual office or a mobile practice for a fraction of the cost, and they may be able to now access these patients in remote areas in real time and right where and when the patient needs it most. And another topic that I really want to touch on is this shift now towards preventative care, right? The fact that we've been waiting both in medicine and in dentistry for things to get bad before we fix them is really part of the issue, right? And part of that has been the limited access to care. The patient doesn't come in until it hurts, right? Until the tooth is broken or the tooth is loose, or until the diabetes has caused kidney failure and now they need to go into dialysis. How do we move and shift our focus into prevention? So in dentistry, for example, we have to be a little bit more focused on remineralization. First, identifying the target population that is at risk. So this is through caries assessment. This is through remote patient monitoring. This is through some of these modalities that I discussed. But how do we take a new approach and see if we can focus on preventing the cavity and preventing the root canal by introducing remineralization, moving towards prevention. So there are really exciting new materials that are coming out, like silver diamine fluoride. There's a phenomenal company based out of Switzerland that has created a product that can remineralize your teeth with over-the-counter products. So it's been shown to actually be more effective than fluoride varnish and significantly less toxic, right? I was in high school, I was in dental school, and I remember I was so infatuated with this remineralization and fluoride. I used to put fluoride on my teeth all the time. And I gave myself fluoride toxicity. I actually, there was several period of days, my central nervous system was depressed. I couldn't think well. I didn't know what it was attributed to, but it was over ingestion of fluoride. So now we have alternative ways through hydroxyapatite to be able to actually fix cavities, literally fix cavities drill free. And so with over-the-counter products, with some of these applications that the patients can do themselves, maybe with the general supervision of a medical doctor or dentist, we will now see a huge shift into preventative care. And telemedicine is going to drive that. Telemedicine is going to be able to allow this access directly to the patients on their cell phone, on their computer, whether they're at work or they're in a hospital or they're in their house. We can now access our patients, and we're no longer limited to traditional marketing. We don't have to pass out flyers in our block, right? You see all these doctors and dentists that create flyers, and they're told and instructed, just distribute this within the next 1 to 5 mile radius. Well, when you take things virtual, you no longer have to worry about 1 to 5 mile radius, right? Your patient pool just expanded to the entire state. So I think this is it's really exciting. I think it's going to certainly help patients, but really just equally important for me. I think this is gonna really revolutionize how we run our practices and how we generate our income based on prevention or based on fixing problems after they've gotten out of hand. So I had some slides that I wanted to go through, but I think the most important thing that I really want to convey to medical doctors, to new graduates from dental school, and to those who are thinking about retiring is really introducing themselves to whatever capacity they feel comfortable with this new technology. It's super exciting. Imagine the days when we had to pull teeth that now we know we can save. Imagine the initial days where implants were coming out. It was a little bit scary for a lot of people. I have to actually put a screw in someone's jaw, but it's become commonplace, and now it's almost unbelievable if your office doesn't offer implants, or if you're not familiar with bone regeneration, sinus augmentation. So we're in that early phase of telemedicine, and my recommendations is really for anyone who's involved in any capacity, from really office manager to hygiene to GP to specialist, both on the medical side and the dental side, to take courses like this to get a good introduction to where we are today, where the policies are, where the legislation is, where the insurance companies' policies are on this. Are there new emerging opportunities? And expose yourself, even if you don't want to participate fully at this point, to at least be able to see into the future of where we're going. And then once you see your area of interest, whether it's geriatric care, pediatric care, virtual consultations, providing second opinions, or as a medical doctor or a dentist, being able to utilize telemedicine to provide mentorship for other doctors. Not even dealing with patients anymore, but providing your expertise to other clinicians who are working on the front line, and continuing the evolution and development of your career. Expose yourself to these different facets, and feel comfortable knowing what your limitations are and what your capabilities are. And then from there, you'll be able to go a little bit deeper into whatever aspect of telemedicine you find comfortable. So the Global Summit, I think, has done a really, really good job. The Doctor of Healthcare Business, I think, is going to be a phenomenal program. I am very excited about teaching this course, and we'll also bring in other lecturers who are very involved in telemedicine to be able to kind of give their point of view. We will have really good literature review, multiple books that have been that will be recommended. And I think this is something that you can do in the comfort of your own home. You don't have to physically travel anywhere. You could do this virtually in the convenience of wherever you're located, and allocate some extra time, which could potentially be very, very rewarding, I think, personally and professionally, but also financially, by being one of the early adopters of this really paradigm shift that's occurring in our fields.
Yes, I'm a little bit involved in entrepreneurship, and I've been looking for some entrepreneurs projects all over the world, and I see many of these small devices they are using to monitoring the patients, and they are helped by AI, and that's the way it's going to move to, because I see small thermometers that really small ones that you put everywhere in your body, and you stick it to it, and you can monitorize this patient for about 3 days or 4 days, and you have information taken about, I don't know, maybe 100 times per hour. So it's different measurements all over the day for 3 constant days, it's going to make curves. It's not going to be just a photo of the moment. It's going to be a movie of the whole process that the patient is going on. And that's one in Taiwan. And I remember another one in Finland, that they're making this kind of monitors for 12 different signs. And it's incredible how technology is evolving and how it's gonna be involved in teledentistry and telemedicine, and how we're gonna get more efficient data and more efficient ways to treat our patients in a different way, and see how any disease can be moving through time, and it's going to be monitorized for us, and it's going to be a wonderful way to see medicine, dentistry, chiropractic, whatever you have, to to monitorize your patients and see it in our offices. Also, what you told us about how the we can measure the efficiency that we are doing in our practices also, and the business thing that you're going to monitorize, and how you're going to be as the IRS and all that government is going to work with us, and they're using AI to see how we are doing. We're going to use AI to do it better and have no problem with them. So it's going to be a wonderful way to do it. And that's a very interesting course. I'm going to be your student in that course, because I'm very excited with all this technology that you're going to show us in your course. So thank you very much, Arash.
Thank you. Thank you for having me. I'm very much looking forward to it, and looking forward to meeting our colleagues from across the globe, and really creating an amazing ecosystem where everyone can participate, collaborate, work together, and really help improve, this evolution of our fine profession. So it's certainly my honor and privilege, and really appreciate this opportunity. And I'm looking forward to meeting everyone soon.
Yeah, sure. And we're very happy to have you here, have you with us, because it's gonna make it's gonna make a different way to see a DHP. You have to see it from all sides, and to make a grow and a better practice and a better professional, a healthcare professional. You have to know everything about how you work, how you improve your practice, and how you manage it better. So thank you very much, Dr. Arash. It was a wonderful, wonderful hour. It was very interesting. It's a very interesting topic. I love it. So
Thank
to all our friends that are around the world, you can get your CE credits in the comment parts right here on Facebook. So Arash, thank you very much. I hope to see you in a couple of weeks. We're gonna meet.
Yes. Yes, I'll see you soon. I'll see you soon in Miami. And again, thank you so much to everyone, and very much looking forward to having you participate in this amazing new program. And again, great honor. So stay safe, stay healthy, and we'll see you soon.
Thank you very much. And we will see you soon in about 2 hours. We're going to be, in about an hour, it's going to be Emily Lefran with Dr. Howe. And thank you, and keep with us. Thank you very much, Arash. I'll see you soon.
Bye-bye.
Bye-bye.